Good morning dash afternoon, everyone. We are officially in afternoon now, I think. Thank you for joining us. We are probably going to just get started. I know that it's full day for most people. So thank you for joining us today. This is yet another edition of our policy forum. My name is Julie Bershadsky. I am the Director of Community Living and Employment here at ICI, University of Minnesota. My preferred pronouns are she and her. I'm a white middle-aged woman with short black hair wearing a black University of Minnesota sweatshirt. And I'm sorry that I keep pausing. I have to admit people as they're entering the waiting room, which is somewhat new. Okay, so as I said, thank you for joining us for this edition of the ICI Policy Forum. We try to do these on a regular basis, once every 2 months or so. The topic today is based on the latest edition of the Policy Research Brief, as usual. The title of that brief and the topic today is Access and Unmet Needs for Technology for People with IDD. And we'll be using results from the FIND survey to form the discussion. So some housekeeping notes. Today's forum is being recorded, as they always are, and will be posted on our website along with the slides. You'll get a link to the posting afterwards. Today's discussants are Emily, Unholz-Bowden, Zoe Pan, who are both Minnesota LEND fellows from last year. I will ask them to introduce themselves shortly. Also with us is Paul Sanft. He's a director in Pacer Center's Simon Technology Center. And then also joining us are Lynda, Lahti Anderson, and Brian Abery, our colleagues from ICI here. They will introduce themselves shortly. As with all of our forums, this is an informal discussion, so feel free to chime in at any time, either via voice or chat. We'll have some discussion questions at the end for the audience. Just a reminder, in our current world, please remember to be respectful of each other's opinions and just respectful in general. With that, let's get it started. I'm going to ask our discussants to introduce themselves, and then we'll briefly talk about the issue and the data before we launch into the discussion itself. So Emily and Zoe, would you like to introduce yourself, please?
Yeah, sure. Hello, everyone. Thanks so much for joining. My name is Emily Unholz-Bowden. I'm a research associate here at ICI. I'm a white woman with brown eyes, brown hair that's currently pinned up, and I'm currently wearing a black shirt and black cardigan. Zoe, take the lead.
Thank you, Emily. Hello, everyone. My name is Qichao Pan, and I go by Zoe. I use she, her pronouns. I was a LEND fellow before, and I'm currently a doctoral candidate in special education program at the University of Minnesota. I am an Asian woman, and I have long black hair, and I'm wearing a navy sweater.
Great, thank you. And Paul?
Hello, everybody. My name is Paul Sanft, and I am the director of Pacer's Simon Technology Center. We're an assistive technology resource center and lending library. I am a middle-aged white male. I have grayish dark hair and beard, and am wearing a green button-up shirt.
And Lynda and Brian, please.
Hi, I'm Lynda Anderson. I am, I guess, on the upper end of the middle-age spectrum. I am a blonde. I have my hair pulled back. I'm wearing glasses, and my sweater is tan with flowers on it, and I use she, her pronouns.
Hi, I am Brian Abery. I'm a senior research associate and director of the Global Disability Rights and Inclusion Program at the Institute on Community Integration. I am a white male who's old enough to be receiving weekly emails from the University of Minnesota asking me when I'm going to retire.
I didn't know that, Brian. All right, so thank you for the five of us, to the five of you, for being here. As I said, today's policy forum is about access and unmet needs for technology for people with IDD using results from the FIND survey. The topic is based on this last issue of our policy research brief shown here. I just wanted to show you what it looks like, front page and back. It's a 2-pager, and we will be walking through this brief to help us with the discussion. So before we start with the discussion, I am going to ask Emily and Zoe to sort of set up the research issue for us, why we're talking about this, what's important, and what is known.
Thank you, Julie. I will get started and pass it over to Emily. So today we're going to talk about this assistive technology. So what is assistive technology? It refers to the tools, devices, or systems that help people in their daily activities. And assistive technology can be high-tech, like voice control systems, text-to-speech software, or it can be low-tech, such as adapted utensils for easier gripping. And today we're going to talk about for individuals with intellectual and developmental disabilities. Assistive technology shows a very positive influence on enhancing outcomes associated with education, employment, social interaction, independence, and quality of life. For example, in the working setting, an adult with IDD who is experiencing challenges with multi-step processes might use an app that can break down tasks into manageable steps. So this specific adult can view each step with visual prompts or reminders. And this support will foster greater independence and help the adult successfully complete the tasks aligned with their skills. And I will pass it over to Emily.
Yeah, so we know assistive technology can be very helpful for people in enhancing their quality of life in a variety of different areas: employment, community living, community inclusion. However, people can face various different barriers in accessing assistive technology that's useful and appropriate for them. One being that, there are several resources out there in nonprofit organizations, such as PACER, the ARC, Simon Technology Center, that can help people and families identify useful assistive technology and even lend out devices for people to borrow and explore. However, there are families who aren't aware of these resources, and particularly families of underrepresented groups. Another barrier that we have found in our previous work is that is kind of that transition between child services and adult services. So the services that children may receive in schools or through home and community-based services, those eventually can change. And there's a point where people need to apply for adult services. And so, that transition between services could really serve as a gap in time for access to technology. But also it's possible that eligibility may change, that a person may not be eligible for certain assistive technologies once they leave school. And so that can certainly be a barrier for some. And then in addition, adults who are waiting for home and community-based services, who may be on a waiting list to receive those eligible hours, unless you can afford certain technologies that are more expensive, you might be waiting a long time to have access to certain technologies. And so that can certainly serve as an additional barrier to individuals and families, potentially in the long term. And yeah, I think we can move to the next slide.
Thank you. All right. So we are going to show you some actual data. Before we do, though, I'm going to ask Lynda to talk a little bit about where the data come from, because it is important to understand, because that does have bearing on sort of how the interpretation of the data and what we can and cannot say, limitations of the data. So Lynda, can I ask you to talk about FIND, its history and the data, where it comes from, and sort of things to keep in mind as we're looking at it.
So FINDS is an online survey that we conduct in partnership with the National ARC of family caregivers, and that is anybody who's in a from family-like relationship. It can be chosen, adopted, biological. Participants are mainly parents, but there's grandparents and spouses and siblings and other family members who participate. If somebody's primary role with an individual is as a paid support person, they're excluded from participating in the study. So that we distribute it online through the ARC, parent-to-parent networks, and other advocacy organizations, along with just general social media. And we have participants from all 50 states, DC, and 3 of the territories, although the territories had very few people, so not a huge, can't say a lot about their experiences. About 3,100 people participated and filled out enough of the survey for us to be able to use their data. The survey, while we tried hard to make it more diverse than it has been in the past, we have done it in 2010 and 2017 in addition to 2023. We've gotten better, but it is still a fairly affluent sample with quite a few people with college educations, and mainly white, mainly women. And obviously, because it's an online survey, it are people who are comfortable with technology to spend a lot of time taking a survey and have access to the internet. So those are some of the caveats about what we're going to talk about, but I think, which I'm sure Emily and Zoe will note later, is that we're talking about a group with a lot of access to technology, which when you put that in the context of the data, you're going to see is important to think about for the other people who don't have a lot of access.
Yeah, and if I can ask, the FINDS has been around for how long? Like,
Yep.
This
is the 3rd iteration. The first one was done in 2010, and then we did one in 2017, and then this one was 2023, and we'll be doing one in a couple of years again.
Right. Thank you for that. All right, moving right along, we are now going to look at a couple of data points. So key findings. I'm going to ask Emily and Zoe to describe each key finding that they've sort of put together. And then we are going to have a conversation with our panel around those data and what they mean, and what they don't mean, and what their perspectives are. So with that, this is our first finding. And Emily and Zoe, if you can briefly describe what is on the slide, what this data are, and how to interpret it.
Yeah, I will start with the first key finding. So the first key finding is, according to the caregivers, older individuals with IDD had less technology access, and people who were school age had greater access to technology. And if we take a look at this figure, we will see which compares the technology access among individuals with IDD across 3 different age groups. You can see 3 different colors of the bars, and they are 21 and under, 22 to 54, and 55 and older. And the data indicate that older individuals with IDD aged 55 to 65 generally have less access to technology compared to younger groups and this difference actually across various aspects of daily living, such as community involvement and employment. And conversely, the school-age individuals who are 21 and under have greater access to technology, especially for the activities related to education. And a couple of highlights here of the data is, if we look at the access to the broadband, over 88% in both younger age groups, 21 and under and 22 to 54, have broadband access, while only 68% of those 55 and older do. And if we look at the education and related activities, younger individuals who are 21 and under have high access for school attendance, like 92%, and the related activities like homework, which is 69%. Whereas these rates are much lower among older adults, who are 37% and 28% respectively. And last point to highlight is community involvement and employment. Those aged 22 to 54 have the highest access, followed by the youngest group with the lowest access observed in the oldest group. For example, you can see there is only 31% of those who are 55 and older can perform their job using technology. So Julie, this is kind of overview of this data.
Very good. Thank you, Zoe. So, okay, I have, sorry, Emily, did you want to add anything to the description before? Okay. So, couple of questions to the panel, all of you, all of us. So what about these findings? Zoe talked through some of the areas like of note. So some of them make sense to me. For example, that for school-related activities, you'd expect people who are over age of 55 to use technology less for those types of activities because they're less likely to do those kind of activities. But what about these findings stands out to you, especially as far as the different areas of technology access? And I'll just open it up to whoever on our panel first, whoever wants to go first and give their perspective.
I could start. So something that was noticeable to me that it kind of, and I agree with you, Julie, that there are certain areas where like these trends are potentially expected. But then there's also areas where kind of proportionally seems to be lower access across all age groups. So such as like getting where someone needs to go, choosing community supports and performing a job, that these percentages are lower across all age groups. So that might suggest to me that there are certainly areas of life where there's kind of lower technology access, more generally, that, might suggest for future work that those areas are important to look into. But I'd like to hear other thoughts as well.
Well, I could chime in a little bit here. So I come at this from a point of view, a lot of the people that I work with, I'm introducing the existence of certain technologies for the first time. They're learning about things that maybe they didn't know before. And seeing this gap or this difference between age ranges matches up with a lot of what I've seen in that schools, for example, will show and provide a lot of technology for kids right now. We work really closely with a lot of schools to help with that. Whereas someone who's 55 and older, they likely didn't have that in school. I certainly didn't have that and I'm in my 40s. And so it makes sense that they wouldn't have not just access to technology, but knowledge of the existence of certain technologies. So if you don't know something exists, then you're likely not going to have access to it. So I mean, it matches a lot with what I've seen in my work.
Brian, Lynda?
I guess I would say that, yeah, the results aren't surprising for me. Oftentimes what we do see is children with IDD who have extensive access to technology during school, although what we don't know is what technology we're really talking about here, because the FIND survey wasn't specific about that, primarily in the context of alternative augmentative communication devices, iPads, Chromebooks, and things like that. And when they leave school, there is oftentimes a dramatic drop-off in their access to technology. The one thing that the FIND survey also, doesn't ask questions about that I think we need to consider here is the extent to which most individuals have access to an organization and a center like Pacer's Salmon Technology Center, so that they have access to technology that they can use and they can use easily. And that really is a good match for both their needs and their capacities. All too often, what we have seen is technology is provided, and the assumption is that people will just be able to use it. And whether it's an aging person who really isn't very knowledgeable about technology, or an individual who has a more significant disability, oftentimes technology just sits and isn't used.
Does anybody know how well or not well this jives with the age difference, especially for older folks, in the general population as far as access to technology? Because here, this is people with IDD and the aging different, right? And so did anybody know about whether we see similar patterns? I would think probably, at least in some areas, in the general population.
The research of which I'm aware is really consistent with this. However, this is also the group, that aging group, that has the biggest drop off of accessing technology and then not using it, primarily because they don't have enough supports to really learn how to use it effectively.
Thank you, Brian. I'll add that a couple of areas that kind of stand out to me as far as that age difference that is not explainable or should not be explainable by sort of natural factors that you would think, is the area of, for example, finding or choosing community support. Technology could certainly be helpful for all age groups in that area, right? Then making choices in personal life and the broadband issue. I do find it interesting that technology seems to be used for getting places in the older group as well. At least, well, I mean, you can argue about 54%, whether that's high enough, but compared to the other two groups, it's not that big of a difference. So that's an interesting observation for me as I'm looking at this data as well. All right, if there are no comments or questions from the audience, we can move on to the next finding.
Yeah, one thing I do wonder, speaking to your point about those specific areas that you're finding differences, that for older adults with IDD, I wonder if some of that might be explained by kind of a natural loss of autonomy for this population in those areas, just if they're receiving like additional care in group homes, or that might be suggestive of kind of like general loss of autonomy and be able to make decisions, and that kind of like following that lack of access to use AT to do those things, but just an idea.
It also makes me think that it might be sort of worth looking at the middle age group, 22 to 54, and more granular age categories, because it is a very broad group, right? And perhaps there may be some differences that are being masked when you look at that broader group. So, all right, we'll talk about the next finding here. One more. And again, I will ask Emily and Zoe to first describe what we're looking at, and then we'll have a conversation about it.
Okay. So the key finding here that we'll be discussing is that family members caring for individuals with IDD have reported that for those individuals that are on a waiting list to receive government-funded services, such as home and community-based services, are more likely to report having at least one unmet technology need versus those who are not on a waiting list to receive those services. And so just talking a little bit more about what is on the graph. So this graph is split into two groups. Again, individuals reported to be on a waiting list for services and those who are not on a waiting list. And then within these groups, the bars represent the percentage of people who were reported to have no unmet technology needs, which are the bars in gold, or at least one unmet technology need, which are the bars in burgundy or red. And so among individuals who are not on a waiting list, 50% were reported to have at least one unmet need, and 50% were reported to not have any unmet needs. And then among the group that are on a waiting list for HCBS services, 58.5% are reported to have at least one unmet technology need, while 41% about there were reported to not have any unmet needs. That gives a description of that graph.
Thank you. So this is a much, obviously, sort of simpler slide. So we'll just launch into the discussion. And my first question, again, is a pretty simple one. What about this finding stands out to you, if anything? And are you surprised by anything here?
I can get started. I would say it's not surprising for me, but I'm very happy to see that individuals on waiting list for service are more likely to have the access, to have the unmet technology needs compared to okay. So who are on the wait list have more needs met compared to who are not on the wait list. So, which means if there's the delays in receiving the support may create the barriers to technology access, which of course will potentially limiting individuals' abilities to fully participate in their life. But I have one, of course, actually it's two curiosities. Is like, I think it's important to interpret this data with more questions is, I would love to know, because the difference is between those on and not on the wait list actually is not that substantial for me. And the limited information from the finds data leaves many questions unanswered. For example, I'm interested to know whether individuals on the wait list experience meaningful improvement in their daily lives when at least one unmet technology needs is addressed. And is there any difference between at least one needs addressed or two or three, for what are the numbers of the needs related to the meaningful improvement of their life quality? And I would love to know, are these the needs being addressed related to their high satisfaction of their life? Because I think, like Brian just mentioned, people might get access to the technology, but they might not using it. So the access to the technology might not translate to the utility, and it doesn't, directly translate to their satisfaction of their life quality or the meaningful improvement of their daily functioning of their daily life. So I would say I just have many curiosities and many questions want to know from the future studies.
Yeah, I think that's a really good point. And I mean, in looking at, thinking about this graph a little bit more, I mean, still 50% of people that aren't on a waiting list supposedly have, at least one unmet need. So a couple of questions that come to my mind, similar to, I think, Zoe, is, one, we have found in some states that just because you may not be on a waiting list for having the eligibility to receive services doesn't mean that you still have access to services. There are still regions in the United States where people aren't able to access the services they need. And so, that could be part of having, just because you have the hours or the services provided or available to you doesn't mean you can access necessarily the assistive technology that you need in your area. But then also, are there barriers within current services where, people aren't necessarily appropriately assessed for the type of AT that could be useful, or maybe reassessed if needs change over time? And so, are there barriers within, for groups receiving services that could still result in unmet needs?
Emily, Zoe, somebody has just asked a question about kind of what do you mean by unmet needs? So in what areas was that assessed?
Yeah, that's a good question. So the way we defined unmet needs is either that you still might have access to technology, but that it's not meeting any needs in the areas of, say, school or employment, daily living, or self-determination. And so we're looking at, for these specific, for different quality of life areas, are there still aspects of technology that aren't meeting needs in those areas? So
I think the other thing,
yeah.
I think the other thing to be aware of, and Lynda, correct me if I'm wrong, not on a waiting list doesn't necessarily mean the person is receiving home and community-based services. It just may mean that they haven't applied for home and community-based services or have been declared not eligible for them.
Or it could be, they could be getting maybe PCA services and they're waiting for a waiver. So it's not necessary that they're not getting anything, but I think about 20% of the sample, of the whole fine sample, did say that their family member wasn't getting any formal supports, which so I don't know if that means that if they don't want them, they still wouldn't be on the waiting list versus people who are in that 20% who are on the waiting list. So that's not huge numbers. So I don't think it would affect these percentages a whole. That's some of the finer detail of the who is getting services and who isn't.
Well,
I will go ahead, Paul.
I was just gonna say, for me, the info the thing that really stands out is the fact that regardless of if they're on a waiting list or not, there's 50% or more people that are reporting at least one unmet technology need, and this is also considering the group that this study included, who maybe has pretty good access to technology, and still it's not enough. So you can, assume then for anybody who's less advantaged than the people in this study, it's going to be even worse. But if that number is not close to zero, then we know we have some sort of problem that needs to be fixed. So just the fact that this is, whether they're on a waiting list or not, I think it's a significant issue that there's this many people without technology access or needs met, I should say.
I will add to that too, like the former statistician in me, it looks at the 50% versus, the 58.5% and thinks, okay, so not being on a waiting list and having, either having the services or not wanting the services, that's an 8% more, right? So, okay, that's better. But statistically speaking, given it's around 50% point, it's actually not that big of a difference. So it does make me question whether services are in fact making enough of a difference, as Paul was saying, right? Like, does this issue get better when people have access to services and are not on a waiting list?
Another possible explanation for that tiny difference is some of the states, particularly those with like really long waiting lists, would sort of throw people a bone. Here's a little bit of something while you're waiting for the next 20 years. And so some of that 8%, could also be people who have gotten that small amount of something to do something with while they're waiting for the services they're actually waiting for. And I don't know how many states are using technology for that, but there's other small programs that people might have access to while they're waiting, and perhaps that's where some of that difference in who's getting something who are still on a waiting list. So we don't know exactly how many of those people those are, but it's possible.
We have another question in chat. Would access to services give folks more funding to purchase their own technology broadband, or are they getting access to dedicated AT devices, or is it both? So I think the question is here whether this would be funding to purchase their own versus being provided with equipment. I think I'm interpreting that correctly.
My first thought was it would depend on what state you're in and what their waiver plans cover. Would be my number one answer. And after that, I don't know how Medicaid funds technology outside of the waiver. Maybe Paul knows, but I'm not familiar with that.
Well, I guess I mean, I didn't see all the specific, how the questions were listed, but it sounds to me like this could be funding for a lot of different things. So I guess that would be a next step for maybe future research, is identifying more specifically what funding. Just like one thing that's missing is knowing what type of technology we're talking about in all of these questions, because there's such a wide range in what could be considered technology for this. So that doesn't really answer the question now.
No, but that's a good point, Paul. We really don't know from the questions that were asked on the FIND survey what the specific technology is. And I know that, in most states, there are both limitations on the types of technology that waivers will pay for, and with respect to what amount of funding is available for that. I know that, I work with ARC Minnesota and the Minnesota Department of Human Services on a micro grant partnership program. And, one of the things that those requests for funding to from the micro grants is often used for, more often than not, is technology that is not paid for through a waiver. And then we also get crazy things that occur with, what the technology can be used for, where a, device, let's say an iPad, is purchased to support a person with communication, but it cannot be connected up to the internet to be used for other purposes. The person has to apply for separate funding to get something like an iPad to get on the internet. So, again, a lot of variation between states and a lot of variation within states, just because so many people with disabilities are not aware of the different types of programs that will fund their access to technology.
Mm-hmm. And I'm just looking at the conversation in chat. So yeah, I mean, ideally, if the person is receiving services, receiving public funding, those services should also cover their technology access needs, whether it's by funding to purchase, so sort of more like a more self-directed model, or devices. That is going to vary by state, but that is how a service system is supposed to work. Paul, I wonder, you've been at this for a while. I wonder how you've seen this change, especially like, for example, whether the access technology is covered through different state programs, and just the evolution of all of that.
Yeah, well, I mean, I don't know a lot from each state. So one of the biggest challenges that we have at Pacers Center is relaying information on how to fund technology, because we don't actually do that. We have a lending library where people can check things out, but then the next step is tricky. But each state does have an assistive technology, a federally funded assistive technology program. All states have that. In Minnesota, it's called the Minnesota STAR program. And so whatever state people are watching from, you have a program. But for me, one thing that really stands out is the tool. The technology itself is not always the solution. And in fact, it's rarely the solution. It's the strategies that go along with the technology. And so much of what we do in our work is not saying, oh, here's a cool device, give it a try. It's, what are you trying to accomplish in your life? What are you trying to read something? Are you trying to communicate something or write something? Are you trying to be, more comfortable while standing at a register or something? And so it's not so much about the tool. It's about the individual, their strengths, their goals, the environment that they're in and what they're trying to do. And then we identify the tool. So in any situation where the tool is being given out first, there's a lot of things that haven't been asked and haven't been discussed yet. And it's like, and so we do a lot of that where we have people come in, they have this technology that they're using, but then we end up looking at something completely different because what they were trying to accomplish wasn't considered.
Interesting. All right. I think we'll move on. So next on our little agenda is to talk about the possible solutions. So Emily and Zoe put together a set of policy recommendations for the brief, the 2-pager brief. So I'm gonna ask them to walk us through those, give the reason for why those recommendations were given, and then we'll share some reactions to that as well. So Emily and Zoe, to you.
Yeah, I'll start and then I'll hand it over to Zoe in a moment. Yeah, so you know, based on the kind of preliminary information data that we just talked about, you know, given that we potentially see some evidence that assistive technology becomes less accessible as, you know, as people get older or for older people, you know, I think even though there's some kind of age gaps that we discussed in terms of, you know, that middle age group being kind of a wide range, but you know, thinking about like what can be done early to support people in having assistive technology kind of in the long term and to kind of maintain that access. So kind of, you know, thinking back to, you know, school age services and what can be done as part of special education. So I think, you know, within that, providing some additional support, because we know that assistive technology can be provided to students, and they may or may not have access to that same technology as an adult. But, you know, along with that, I think, you know, doing some assessment and helping students to understand, maybe even in secondary education, like what are some things that are going to help you in employment or for going to college, and kind of giving families more of an understanding of what could be really useful in the long term, so that when they are applying for adult services, they're kind of already prepared to know what to request for and what they might be eligible for. And then, you know, similarly providing, I mean, we find so much like in transition services that families aren't necessarily prepared for applying for those services, for home and community-based services. So providing more support and preparing families to actually apply for those services might reduce the risk of that kind of transition gap where people might lose access to technology once they are an adult. That's one point. And then kind of going back to the waiting list piece, that, you know, there although you know, kind of some debate, but you know, we might have some suggestion here that being on a waiting list for HCBS might, you know, lead to having some unmet technology needs, maybe not significantly more, but might having some compared to others. So one consideration is thinking about like, where are other sources of funding that people can access to, you know, to gain more access to assistive technology. So whether that be through nonprofit organizations or even through research projects that can help support at least temporarily funding assistive technology for people who are waiting for government services, or as Brian mentioned before, supporting funding for technology that that people may not be eligible to receive as part of HCBS. So that's another piece to consider. And then kind of going back to schools and services there, I think something really important would be for schools to help connect families to all these variety of organizations and resources, such as, you know, Pacer Center, the ARC, Simon Technology Center, that could be really useful for, again, like exploring different assistive technologies, learning how to use different technologies, and, being able to have loans and try them out. So, better connecting families with those services and resources so that people can access technology that has utility and that can actually meet their individual needs. I'll hand it off to you, Zoe.
Thank you, Emily. So the next policy recommendation we propose is to encourage states to invest in the technology-first solution for people with IDD. Technology-first initiatives prioritize technology as a foundational solution in supporting individuals with IDD, and at the same time recognize that access to appropriate tools can really enhance independence, improve the life quality, and reduce the reliance on traditional, often more resource-intensive support services for individuals with IDD. And we think for states, investing in the technology first is especially important due to all the states have aging populations with older adults with extensive support needs, and we have maybe the workforce shortage in the disability service sector. And we think by embedding the technology first initiative into the support model, the states can help address the service gaps and empower individuals with IDDs to live more independently. And the last recommendation here is ensure the equitable access to technology resources for individuals from diverse cultural communities and those with fewer economic resources. In this latest Find survey, we did not include questions specifically addressing technology, access, utility, and unmet needs across different cultural and economic backgrounds. However, we do have one question that asks specifically the need for cultural sensitive resources. It's not, directly related to technology, but I think it can also give us some thoughts because the data, the results of this specific question reveal a significant disparities across racial and ethnic groups. So some example is 34% of Asian respondents of Find's data and 39% of Black or African American respondents identified access to culturally sensitive resources as a major problem. But this is compared to only 15% of white respondents share the same needs. So we think these findings actually underscore the importance of examining if the access to technology within different communities to better understand whether this similar disparity exists in the technology aspect. And investigating these needs would help us actually to ensure that technology resources are equitably accessible and culturally relevant, supporting the effective engagement and the positive outcomes across all communities.
Thank you, Emily and Zoe. Any reactions to these recommendations from the rest of our panel?
Yeah, I have a couple of things to add as much as kind of react to the policy recommendations, because I would agree with all of those. What I do think is we need to do, a much better job in a culturally responsive way, making sure that people are aware of the technology that they could potentially have access to, and to make applying for that technology a much more simple process than it currently is, as well as expanding the use of technology. And related to that is this whole notion of what we refer to as technology, because that's changing very, very quickly. 10 years ago, we were talking about iPads. Now my colleagues and I are doing some work with the Computer and Electrical Engineering Department here at the University of Minnesota to take a look at how socially assistive robots can be used to support individuals with intellectual disabilities and other disabilities, especially those who are aging, with respect to kind of providing supports that live staff, human staff, are not able to provide. And just the differences that we've seen over the 3 years we've been working on this project and the capacity of the socially assistive robot that we're working with, has been absolutely massive. But all too often, I think we think too narrowly about technology and what it might be able to do to support people with disabilities and the individuals who support them.
One thing I'll say is these recommendations are great recommendations for all humans in all categories. I think they're all very beneficial. But if we think about individuals with IDD, especially when it comes to fewer economic resources, one example I like to look at is augmentative and alternative communication devices. They can, like software, for example, and not to mention the devices themselves, can be very, very expensive. And to do something that's, there are options that are cheaper, but usually those cheaper options require much more setup or maintenance or things that tend to be more difficult for someone with an intellectual disability to maintain over time. And so they become less effective than the more expensive things. So what ends up happening is not just do we need more money for certain things, but that education piece on how to maintain things that maybe aren't as expensive. If that makes sense. I'm not sure if I said that right, but it just seems for this group in particular that the study is touching on that those last two items are particularly important.
The other thing that I would like to add, and this is specifically for individuals with intellectual disabilities who are receiving supports through community residential programs, is that oftentimes technology is not made as much use of as it might be because staff aren't trained to use it and staff are fearful of using it. In some cases, because they're afraid what might happen if I use this and something goes wrong, I don't know how to problem solve. So we need to do a much better job training staff on the effective use of technology and how to problem solve when technology goes awry, as it sometimes does.
Yeah, great point. That is actually okay. So this is going to be a nice segue into sort of my general discussion question. This is where we open it up to the audience. Anybody who wants to participate, please chime in. We want your input into this conversation. So just talk about it. What does having access to technology mean, or should mean? I think in that question are multiple questions. What is technology? What is access? And given that things are changing all the time, how do we keep up with that? All of that, I think, is kind of nicely wrapped up into this one very simple, seemingly simple question. So we can start with our panel, or if anybody in the audience wants to just jump right in on this, go ahead.
I could start with kind of, one aspect of it, to me, kind of a simple aspect is, and it kind of, I think, bounces off of what Brian was talking about, that, part of access to technology is being able to have access and use like a variety of different technologies, whether they be low tech or high tech, for, across all the different areas of life that you might need it. We all use this like technology of some sort for, a million different things, whether it be for our home, for work, for school. And so I think, it's not just having access to one thing, it's about having access to multiple things to meet all the things that you're doing and all the things that you need. So that could just throwing that up there to start, build from there.
I can follow up a little bit, because I think this is a great question when we are talking about access. What are we really mean the access? Because at first I would say, just getting this assistive technology products, no matter it's high tech, low tech, in which modes, is the access we're talking about, but truly behind that, before you get this assistive technology products, you need to get access for the information and education and the training to know that, okay, I have these options and these are the pathways for me to get these kind of help and support to start to use all these products that can change my life or improve my life quality. So I think this is very important because I have some example is when I was working with individuals with autistic individuals with intellectual disabilities. First, sometimes the family member, they do not know they have access to certain technologies. And even they know, there's sometimes no support system for them to go through all the paperwork and to really get the products. And first, the waiting is a very long time. I have kids waiting for like half a year to get the AAC device. And after get the device, sometimes kids will, accidentally like break the device, and it would also take several months to get it repaired. It's a very lengthy process within, and also after in the clinic, the staff really need the training. Like I think Brian mentioned this briefly. The staff really need to get the training. Like, okay, I got this device to support these children, but I need to know how to use device to support these kids. And after these kids leave clinic or the intervention center or whatever service provider, when they get home, how their parents, their family members, their siblings can get to use these products to support their community living, their family living is also, there are many, complicated challenges involving to there. So I would say, providing the products themselves is crucial, but the access to the information and the guidance and education and training are also really essential around this whole thing about access to technology.
I'll jump in on just the concept of technology for humans in general. I mean, we come up with technology to make tasks and things and experiences better, and having access to technology is, like Zoe said, having the information on how to use it. Like I've mentioned many times, it's more than just getting the tool, it's learning how to use it, but also to me, having access to technology is kind of like having the ability to be creative about problem solving. And what I mean by that is if you have a problem that you have no idea technology exists that could solve that, you might never even go down the road of considering it. So one example that I like to use is someone came into our lending library who was looking, he had dyslexia, he was looking for tools to help him, read things on a tablet, but he also had just one arm. And when we were in there, he noticed, and I just happened to mention it, that we have a one-handed fingernail clipper. And that is never something that he ever considered would exist. He was just dealing with the fact that he couldn't clip his fingernails on his own. It was just one of those annoyances with life that he never considered that technology could be a solution to it. And so if you multiply that concept to every piece of technology that exists, having access to me is having almost like the freedom to be creative about solving problems. So I don't know the best way to word that, but I try to tell everybody who comes in, if there was like, what is a problem in your life? Maybe there's some technology that, if not only could the technology fix it, maybe it can at least make it a little bit better. So it's more than just being able to fund things, more than just being able to know about things. It's having that ability to be creative about solving problems.
I would agree wholeheartedly with what Paul just said. But also it struck me how technology for people with disabilities has been A, developed, and B, researched, or the lack of research on it. When we talk to our colleagues in computer engineering, in the robotics lab, you know, they don't think about first, what are the needs of people with disabilities? You know, what are the challenges they face, and how can we develop technology to solve those? They look at, oh, this would be a cool thing to do with technology, and then how can we fit it to people? I think, you know, we really need to take more of the, I guess, the process that commercial organizations have done, which is really to focus on making sure that people with disabilities are able to kind of be part of this development process, telling us what their needs are, where technology is most needed, the types of things they need in technology to be able to use them, and to really drive that development process off that. Now, unlike the researchers, okay, the commercial organizations we have found, you know, oftentimes do little to no research with innovative products that they've developed. And so we oftentimes don't know to what extent this innovation, you know, actually is going to make a difference in the lives of people with intellectual and developmental disabilities. You know, I think part of it is getting kind of those commercial tech groups and the research groups and people with disabilities together. So this whole process is being driven first and foremost by people with disabilities, but that the commercial groups and the research groups are working together.
I'm gonna throw a question out to the group and to the rest of us. So anybody jump in. This is kind of a follow-up question that occurred to me as we're talking. What do you think are the biggest barriers to providing access to, however we define access, and to technology, however we define technology? But like, if there's like one, because there are multiple things that we've sort of talked about, right? There's funding, there's resources, there's information, there is lack of culturally appropriate resources, information. If you could have a magic wand and could change one thing that you think would be most impactful, what would that be?
I'd start with access to information. And that can look like so many different things, you know, access to information in a format that you can retain, that you can utilize. So using that magic wand to change lots of different things under the umbrella of one big, but it is that access to info is where it starts. Without that information of what technology can do and be, I think everything else gets lost in the shuffle.
Yeah, I had the exact same thought, because even if you have the resources, even if you have, you know, services that work, yep, without that information, without knowing that it's out there, then people aren't going to have access to it.
Different or other views or opinions? All right, just looking at chat real quick. So Jerry Smith, who is a part of our ICI team, just wants everybody to know that the next issue of Frontline Initiative, which is a publication, is about technology, and we'll launch in a few days. And he put a link to that publication in the chat. All right, we do have one more sort of discussion question, but we kind of already sort of throughout talked about this. So to the extent that there are other policy recommendations that can be made, what would they be? Could we come up with something more different, innovative?
Yeah, to bounce off what Paul has talked about, it really emphasizes the need not just for, you know, access to the like devices or technology itself, but, you know, access to training and information on how to use it, both on the, you know, part of that the person with disability actually using it, but also anyone supporting that person using technology. And so something I really don't know about like home and community-based services is, you know, the funding provided through that, you know, is it just for the technology itself, or does it sometimes or always or rarely come with training. Like I've heard different stories from different people. And so I don't know, you know, again, how much that like training is tied. Funding for training is tied to funding for the technology itself. And so, you know, if we were, this may not be like, you know, directly like we need a policy that does this, but just as part of, you know, regulations for those services, really enhancing the services to include training and tech support, I think would be really beneficial.
Yeah, and although it's not a policy recommendation per se, you know, I think what we do need to think of is when policy is developed in any area that is likely to have an impact on people with IDD, there should be a technology component that's considered. You know, whether we're talking about employment, post-secondary education, transition services, you know, community living, transportation. You know, I mean, technology plays such an incredible role in our world right now that, you know, if you don't have access to it or you don't know how to use it effectively, you know, we're limiting opportunities.
Great point.
And one thought is also not a policy recommendation is when I was what Brian just shared when the commercial the designer teams when they design the technology, it reminded me of a conversation I have with toy game designer who work for the individuals with disabilities. I'm just thinking from the source of how in technology are designed or developed, these kind of universal design philosophy should be really embedded at the you know front at the beginning. So the functions or the accommodations for the individuals with disabilities should not be an add-on thing like, okay, this is the issue happened, so we add on this function to support this specific group of people. It's just when you start to design something related to technology, you should have this philosophy at the very beginning saying this is a product that is aiming for all the individuals regardless of the disability status. So I'm not sure where this thought will be put into the specific policy recommendation, but it's very resonating for me.
Anybody from folks in the audience wants to chime in?
I will. I'll be a voice on the screen. Erica from Massachusetts here, and in Minnesota. I grew up in Wisconsin, so I would just say that I view circling back to a couple questions ago, access to technology. For me, it really just boils down to it. It's a human right, and everybody has the right to live the fullest, richest, most independent life possible. And with the technology, I think you know, we're able to assist in someone exercising that right. And I just appreciate the opportunity to hear the findings of the FIND study and also be a part of just listening to the discussion. And, you know, I think, you know, we're all on sort of the cusp of something very, very exciting. And if I could just bring it back to one of the first screens, I'm so sorry, but I thought it was really surprising that that middle age group of 22 to 54 had 7 out of 10 categories that were the highest percentage of all groups. And perhaps there's something in that, like what is working for that group and can we transfer that to the other groups? And I don't know other than, you know, noticing that, and maybe I didn't do the math right, but hopefully there are 7 out of 10 that the middle category. And I was struck by that. You know, I was struck by that. So maybe there are some answers in that age group that that we don't know about.
Yeah, thanks, Erica. I agree. I think it would be there was enough data and enough data granularity, and sort of going forward, I think it would be good to look at that group and more, you know, in more detail in terms of the age categories.
Actually, I want to, Erica, what you shared, I want to take a little bit further, even when you talk about the technology being a right for everybody. Even more than that, I think the right to choose the technology is an important thing to consider, because when policies do come down and it's like, okay, we're going to get a Chromebook for every kid in the school, the Chromebook might not be the solution. And so having that ability to choose and have input on that technology is also an important piece to this whole thing.
Yeah, I agree. Thanks, Paul.
Yeah, I think another piece, is number one, I think we've already kind of said this, it would really be nice if the Find survey could be expanded, if only by a couple of questions, to get more at what is the type of technology that people are using. But because I don't see a real big change in the people who respond to the Find survey, I think we have to also take that next step and get a better understanding about how individuals from diverse communities think about and currently use and have unmet needs with respect to technology.
Thank you, Brian. So in closing, I don't think we've quite figured out the solution, but perhaps we have some promising avenues to explore in terms of advocacy, in terms of research, in terms of policy. So that's good. All right. I think unless others want to chime in, please do so if you do. Unless there are others who want to chime in, though, I think we can actually close it a little bit earlier today. These are the links that you see on the screen to the policy research briefs, to all of them that have been produced so far, and also the policy forum slides and recordings that will be, this one will be posted at that link in a couple of weeks, usually it takes. And then I also put a link to Paul's outfit on the bottom, so check out his center when you have a chance. Thank you so much. Any closing thoughts from the panelists or anybody in the audience? Well then, thank you very much for joining us. Thank you for your time, and have a good rest of whatever day it is. Wednesday, I think. Have a good rest of your Wednesday.
Thank you.
Thank you.
Thank you all
Thanks,
so
everyone.
much.
Thank you.